Good afternoon, and thank you for tuning in to listen to me talking on artificial intelligence. I am Dr. Major Vimal Raj. I am a consultant cardiothoracic radiologist and I head the cardiac imaging unit of Narayana Hridyalaya, Bangalore. It is a great opportunity and honor for me to be talking to all of you today here on this auspicious 125th year of the discovery of X-rays. I am really thankful to Anto for giving me this opportunity to be addressing the Society of Radiographers of India, and I hope I am able to give you some extra tips, some extra knowledge, and I can introduce you to this new world of artificial intelligence. So, my talk today is going to be on artificial intelligence. Is it a threat or is it an opportunity for a radiographer? The objectives are I would like to go through a stepwise manner. I would like to explain what is artificial intelligence, what does it really mean, what are the different types of artificial intelligence that one may come across, and also tell you what can it do currently, okay, specifically when the radiographer's clinical work is concerned. And finally we will discuss about, is it really going to be a threat for you in future, or is it going to be a opportunity that you need to take up? Now let's start off with a standard definition. What is artificial intelligence? Well, artificial intelligence is any substance, any technique which enables the computers to mimic human behavior. So anything which allows the computer to do what you and I do today is termed as artificial intelligence. Now, looking at artificial intelligence, you have to see that there are different types of artificial intelligence as a broad category. What we are currently dealing with is called as the narrow AI, or narrow artificial intelligence, which is basically training the computers to do one specific task, and they will become better at it, but just that one specific task. The next stage of artificial intelligence would be a general AI. What that means is it takes knowledge from one domain. So for example, you train it in one domain, but it actually is able to use that knowledge in another domain. For example, you are aware that the fire is hot and it can burn your skin. The same knowledge, if you use when you're trying to burn something or you're trying to heat up something, that is transference of knowledge from one domain to the other domain. So AI can start doing that as a second stage, and the next stage of AI might be what is called as super AI, where AI basically outthinks human, or it is able to think much faster, much better than humans. Now, let us look at some of the examples of narrow AI. If you believe that you are not exposed to AI, or you do not use artificial intelligence in day-to-day life, then you are wrong. As a simple example is, if I were to plan for a trip to Goa today, I would go into my Google Maps and say, hey, tell me the fastest route to go to Goa from Bangalore on road. And Google Maps comes up with options for me. This is what an AI is. It is thinking instead of me having to work out a lot of different permutation and combinations. It comes out and says, if you are going through Hubli, it will take you about 11.5 hours. But if you decide to take a road through Hampi and Hospit, then it's going to take you 14 hours. So this is clearly telling me that use this route, this is going to be a better route. This is artificial intelligence. Another example is artificial intelligence, which is there in all of our phones. Every Android, Apple, or any other phones, Google phones that you have, Everything has got virtual assistants within it. They are also examples of a simple artificial intelligence software. If you track the day-to-day activities of yours, you will realize that you are using AI from the time you have woken up till the time you're going to sleep. When you look at YouTube, you type in something and the computer suggests another option, which is again artificial intelligence. The computer is trained that if somebody is looking for, let us say, Goa, why don't you show them the hotels in Goa, or why don't you show them the restaurants in Goa? If somebody is searching for a movie ticket, why don't you show them a Uber or Ola ad so that they can go there in a cab? So these are all different types of artificial intelligence that we are all used to. Look at Google Maps, which I have just shown you. Look at the banking sector where the computer remembers your password. That is again artificial intelligence, and we have got used to these luxuries in our life. So yes, artificial intelligence is already there. We are using it on a daily basis. Some of it we are not aware of, some of it we are very well aware of. Now let's look at a different way of explaining what artificial intelligence is. Now let's look at a different way of explaining how artificial intelligence works. Let's say we're going to cook today and we have our mother, our wife, our sister who is an excellent cook, and we know that if you give her the right ingredients of dal, you give her the right ingredients of vegetables, and she knows from her experience, she knows from what she has been doing to give us a really tasty sambar or dal the way you prefer it. Now this is what happens. Now just imagine if your mother, your sister, or even your cook is not in a good mood, or is feeling she forgot something, or while they are cooking they put something extra which is not their normal standard. You may get different varieties of the same sambar. Okay, if this is by purpose, that's fine, but if you were expecting the actual sambar that you like but you got something different, then you start saying, why do we have to change? The sambar that you usually cook is very tasty. I would have loved to have that sambar. Now let's do the same cooking with our simple AI. Okay, let's say we are fortunate enough to have the super chitty as our computer, which has got all the knowledge, which has got artificial intelligence, and we give it the ingredients. We have given the ingredients, we keep the ingredients in front of it, and we draw up a algorithm. We tell the computer, use this much of garam dal, use this much of brinjal, use this much of lady's finger or carrot. You write it all down. You let the water boil for 2 minutes at this temperature, and then you add this ingredient, and then you add that ingredient, and let it boil for 20 minutes, and then you will get your fantastic sambar. With AI, which is a simple AI in this case, it will keep performing the same task without any variation, and you will get a continuously stable product or a stable sambar. And this is the beauty of AI, because the computer is not going to get tired. The computer is not going to have a different mood today, or not going to be angry and put a little bit more masala in your sambar, or put a little less salt in your sambar. The output of this simple AI is going to be constant in there. And this is what has been happening so far. Okay, we teach a computer a very basic skill, we automate it, and it is able to keep doing it again and again. This is what we are seeing in our industries, where the machines are building different materials, and they are able to do that consistently to a specific quality. But that is not AI in the true sense. The AI now is advanced, and let's look at what it means. Now when you see this image, you can see and realize that these are 4 different cats. Okay, but if the AI is presented with the same question and we tell the AI, please tell us, is this a cat or not? Okay, just looking at these images, AI is not going to be able to tell us. What we need to do is what is called as feature identification. So one level of AI is where we show the AI tool, we mark the tail and say there is a tail here, there are ears of this shape, there are paws or claws, and there are these whiskers that you can see. You input this data into the AI system, and then the AI system learns it, and next time it sees an image of a cat, it is able to recognize it. Similarly, if you give it a picture of a car and you tell the different features of a car, you tell it this is the windshield, this is the tire, this is how a car looks, the AI system learns it. Okay, it is able to extract those features that you have shown it. It is able to classify it internally, and it's able to come out and say, yep, this is car, or no, this is not car. This is what is called as machine learning, whereby we are teaching the machine that these features, if you see, then you can call this as a cat, or you can call this as a car. Now, we've had further progression. We've advanced further, whereby we are not looking at features, but we are looking at data. What does that mean? Instead of showing the machine cat pictures with showing its features, what you can do is show it thousands and millions of data and say, all these images are cats, all these images are bird, all these images are dog, all these images are frog. Now go and learn yourselves. Okay, the system keeps looking at all the images of cats, and it has a neural network that we have built inside it, where the machine starts to learn on its own. For example, if you show a child a cat first time and say this is a cat, and next time the child sees it and says, yep, this is a cat, you don't know what the child actually learned, whether the child saw the eyes of the cat and said, okay, anything which has an eye like that I will call a cat, or whether anything with a tail I will call a cat. So this is what is in artificial intelligence term called as the deep neuronal learning, which is a highly advanced way of machine learning. And this is what is become available in the last 5 years, and this is transforming the way artificial intelligence works. So in a superficial manner, if you look at it, artificial intelligence is the larger group whereby you are training computers. Within that, there is machine learning, whereby we are giving the data to the machine and we are pointing out the features within the data for the machine to learn. The next level, which is the deep learning, is where we are just giving the data to the machine. We are not teaching it anything, but we are showing it the end results. For example, in the Chitty robot case, if you give the machine just the ingredients and you're giving it the masalas, you're not telling the machine anything at all, but you're just telling the machine, this is what I want you to produce. It is the machine's job to reach that point by its own permutation and combinations. Both machine learning and deep learning gets much better as more and more data keeps flowing into the system. Let us look at a clinical example to make it more simple for you to understand. So this is a CT brain of a patient, and you can see that there is hemorrhage or there is bleeding into the brain. Now what we can do is we can mark this area and say this is hemorrhage, and give similar thousands and thousands of images by marking into the computer system for it to learn that this is hemorrhage. That kind of learning is called as machine learning. On the other hand, if we take off all the annotations and we just tell the machine, this is the image and there is hemorrhage in here. Where is the hemorrhage? We are not marking it. So the machine is looking at thousands and thousands of the same image and learning, okay, this is what hemorrhage looks like. This is called deep neural network. So we have seen what is artificial intelligence, and we have also seen the different levels of artificial intelligence and seen how it works. Now it is time to look at what can artificial intelligence do in the field of radiography currently. If you look at the job of a radiographer, you have job which is to identify the patient correctly, make sure that you're doing the right examination for the patient. Then you plan for the examination, you position the patient in the right place, you then start looking at your CT or your MR, you're planning the procedure. Next, you're acquiring the images, you're exposing the patient to radiation, you are planning the MRI sequences, and you're acquiring the data. And finally, you're doing post-processing. So these are the four major components of your day-to-day work. Now let's look and see how artificial intelligence is already there or can help you in doing this work. On an X-ray platform, if you look at this data, there is a automated exposure control, there is a automated improvement of the image, there is also a automated positioning of the image or rotation of the image to get the best quality, which is already present in a lot of your digital radiography systems. Irrespective of the vendor, you will find that you have some form of an artificial intelligence system available to enhance the image that you have already acquired. Let's look at this example of an MRI. One of the major challenges often is a patient who is moving or keeps changing their head position and you're not able to get good quality images. Also, you have to angulate and plan your sequences when you're doing MRI. Now, with artificial intelligence, it is possible that the machine itself will acquire some data and then it can plan automatically the correct plane, so people who are less experienced can actually do the scan and save a lot of time in the machine. Similarly, you can see here, if you've got a pathology which distorts the anatomy, you are not able to clearly see the midline of the brain in this case, which has got a tumor, and then if you're going to plan your sequences, it becomes very hard. But AI can plan all of these sequences for you with just a click of button. I've shown you examples of a brain and you may think, well, this is easy. It doesn't need much expertise. Anybody can do this. On the other hand, cardiac MR, for example, is a very complex procedure. And when you are doing this, you need to be well trained to get good quality data sets when you are doing a cardiac MR. But there is technology available now which can actually do the entire cardiac scan on its own if you just point out 4 specific points in the heart. So you start the scan, you do your localizers, and if you just go through some questions and say point where the heart is, point where the mitral valve is, point where the left ventricular apex is, and the machine does the entire planning and the machine can scan the patient on its own as well. So this is something very, very exciting. This is something very, very useful, especially in places where these examinations are not that common or the technician is not that well trained to perform these examinations. Let me show you another example. This is again very specific to CT and cardiac. The heart keeps moving, so the coronary arteries are also moving. So when we are imaging the coronary arteries, some of the coronary arteries are moving so much that we will not be able to see them properly. As you can see in this image, there is so much of blurring that we are seeing. With artificial intelligence, we get what is called a snapshot freeze. and in that snapshot freeze, which is a technology very specific to GE machines, where you can actually get rid of that movement, and you can see the image again here. The right coronary artery, whatever movement blur was there, can be taken out of, and you will get beautiful images of the right coronary artery. If you think this is fantastic, there have been further advances where instead of just looking at the coronary arteries now, we can actually remove the blurring or motion related artifacts of the entire heart. So let's look at this image where you can see the entire heart is looking very blurred, and just by a click of a button we can improve the quality of the images significantly. You can again see the right coronary artery is blurred, and by just clicking one button you are seeing that the entire image gets better. On the right hand side you are seeing that aorta, which has got a stent in there. The amount of movement artifact is limiting the quality of study, and you apply this snapshot freeze, which is trained on artificial intelligence. It removes all movement artifacts. So you can see your planning, your acquisition, and even post-processing is significantly improved or helped with artificial intelligence. Now there is also a newer technology which is available, which is going to make your images look even more better at very low radiation. You can see in this example where a patient with a BMI of 62 is getting far superior image quality based on the newer technology, which is artificial intelligence based, even at a much lower dose. So if you look on the left hand side, a filter back projection, which we used to do in past, and now where we do iterative reconstruction, the images are very grainy because the patient is really fat. With the artificial intelligence, the post-processing becomes even more superior and even more crisper, and we can see this beautiful image quality. So knowing all of this, you start thinking, should I relax or should I really worry? Is my job in danger? Should I really be looking for a job change, or should I just relax and say, hey, this is not going to happen to me. I am not replaceable as far as radiography is concerned. There is certainly a threat, okay? With artificial intelligence, what is likely to happen is the radiographers are going to get more and more efficient. By that, a job which needed 3 radiographers now could be perhaps done by 2 radiographers. So your job is going to get automated, and as the automation happens, your job is going to get faster, and because it becomes faster, you may not need that many radiographers to do the job. The other way of also looking at it is the highly qualified people may not be required to do the technologist job. You could have somebody with basic degree who understands radiation protection and who understands how X-rays work can perhaps start doing all the work because machines are actually assisting that person in doing the job. It may also come up that you just have to position a patient, or a nurse just positions a patient and the machine does the entire scanning in future. The reconstruction and printing of images may also become obsolete in future because everything might go digital and the machines may themselves be able to reconstruct the data. So you start saying, oh dear, this must be a very big headache for me. I have to start worrying about it. Or some of you say, hey, this is all in presentations, doesn't happen in real life. Let me show you what is already out there. There is technology which has been approved by the FDA of US and it is being clinically practiced, is the use of artificial intelligence in reporting CT scans or picking up major pathologies in CT scans. It is also available to pick up fractures, especially wrist fractures, neck or femur fractures. Also, it can pick up pneumothorax or lung nodules and masses on a chest X-ray. It is also available to detect pulmonary embolism in CT pulmonary angiogram and also look at vertebral body fractures in a lot of patients. So AI is already being used in radiology, lesser for the technologists but more for the radiologists. Would you like to see any opportunity coming out of it? I am an optimist. I personally believe that AI is going to make our life much better, and AI is going to come and be part of our life. So there is no sense in fighting AI, but I think you need to partner with AI and you need to incorporate it in your day-to-day life, and then you become better. For example, every tech will become a super tech because the quality of images that you're going to be producing with AI assistant is going to be fantastic. It also means that you're going to become super efficient. You're going to be able to do the task which takes you 2 hours, you'll be probably doing it in 1 hour time. So that will give you more time and you will become more productive, which may mean that your salary increases, your demand increases, and also you may be able to work sitting at home remotely, providing your services to multiple diagnostic centers or multiple hospitals because the technology is available. The other thing which I would like to concentrate on, newer roles. Okay, this is something very, very important, and you really need to think about this and start planning your career for future. What is happening in the Western world is the radiologists are not reporting radiographs. The X-rays are not reported by radiologists, but senior technologists or radiographers are trained to report X-rays for them. Similarly, ultrasound scans are not performed by radiologists. They are performed by sonographer or technologists who have trained in sonography. With artificial intelligence, this all job transition is going to get much more common and much more easier. For example, if you look at the x-rays which are done in an orthopedic hospital, radiologists do not often report these x-rays. If artificial intelligence is able to achieve 90%, 95% accuracy, and a reporting radiographer oversees the operation, then it is cheap for an institute. It will allow the radiologist to concentrate on more complex pathologies or interventions that they would like to do. So the radiographers kind of get a promotion. You become a reporting radiographers. You can start doing ultrasound scans because AI will assist you in doing that, or it will open up new horizons for you as you start to adopt AI. Also, think in terms of who is training AI and how is AI getting trained. The artificial intelligence systems, the machine learning systems are getting trained by people marking pathologies. So I am part of a couple of artificial intelligence groups. One such group is Predible, who I've been consulting for, and we've always looked for technicians to help us in annotating data. So you look at a brain CT and you see the hemorrhage, but we want to train the artificial intelligence that this is hemorrhage, so we need somebody to annotate the data for us. So that could be a radiographer who is good at looking at the images, because the radiologists may not be interested in doing this and they may not be happy to do it at a cost which the radiographers are happy to perform. So you could become an AI enabler coming in future. So think and plan for your future, because AI is here to stay and it is useful for you to get ahead of the curve and start becoming part of this new age. One final thing that I would like to tell you, maybe it is a um, futuristic thing, but I want to be very transparent. So far, whatever I have spoken about is just the narrow AI. I haven't even touched about the general AI or the super AI that one can see. These are some of the predictions. If you look by 2040, in another 20 years, we expect the general artificial intelligence to be built whereby the computers will be able to do most of the tasks that humans are able to do. Something like driving a car on their own, something like reporting a study or performing a scan fully. By another 10-15 years, we are probably going to look at super AI, where the computers are going to get much better than human beings, and we don't know how that future will look. So be prepared, be part of this transition process is what is important. In summary, AI is just like training a child. If you show something to a child again and again, the child learns from experience and starts to recognize those things. AI is very similar to that. It's just a machine which has got very good processing capacity and is able to learn. Also, AI is already accepted everywhere, so there is no sense in fighting AI or refusing to adopt AI. Be an early adopter, be an early enabler, because this will keep you far ahead of your competitors or your colleagues. Lot of technologist work can be replaced and can be made faster by AI. So you have to remain skilled, you have to be very good in what you do. This way, the AI will enhance your capabilities even further. And finally, I would like to say it again that it is time to accept AI as part of our life and plan accordingly. Become an AI enabler rather than somebody who is blocking AI every time you come across it, because it is the future and it is here to stay. Thank you very much for your patient listening.